from a woman with chronic sinusitis shows cytoplasmic inclusions within epithelial cells. Using fluorescent antibodies, these inclusions and elementary bodies are identified. The intracellular organism responsible for the infection cannot synthesize which of these? A. RNA, B. DNA, C. Protein, D. ATP, and E. Lipids.
DNA.
Wrong.
Lipids.
Wrong. The answer is ATP.
Next school.
Microbiology. Last call.
Last school.
Yes.
Microbiology.
Yes, sir.
Blood cultures are ordered for a patient with cancer of the colon found to have sepsis. The most likely organism is A. Enterococcus faecalis, B. Enterococcus faecium, C. Streptococcus bovis, D. Streptococcus viridans, and E. Escherichia coli.
Streptococcus bovis.
Wrong.
Streptococcus viridans.
Wrong. Oh, what was your first question? Answer. Bovis. Okay, correct. Okay.
Next school, please. Bowen, histopathology. Histopathology.
Alright, for this question, you have no option but to tell us the correct answer. Connectional bodies are found in what kind of tumor?
Yolk cell tumor.
No, another try.
Embryonal cell tumor.
No, the answer is granulosa cell tumor.
What part of the heart has fastest conduction? A. AB node, B. The His bundle, C. Purkinje fibers, D. SA node, and E. Bundle branches.
SA node.
Wrong. Second.
Purkinje fibers.
That is correct.
Pathology, you said.
In the first weeks of gestation, the following are the main sites of hematopoiesis: A. Liver, B. Spleen, C. Yolk sac, and D. Bone marrow.
Yolk sac.
Correct.
We with histopathology.
Yeah, you can only answer twice.
No, answer histopathology before. Histopathology.
So you can give two correct answers. There are no options. Anencephaly is a defect of the neural tube and affects which part of the neural tube? Correct.
Biochemistry. Answered anatomy and biochemistry. You cannot answer physiology again from basic clinicals.
Not answer biochemistry. When I answer anatomy,
Yes, that's why you can't answer biochemistry again.
hematology.
Hematology. The following proteins are for transport and storage of iron except A. Transferrin, B. Myoglobin, C. Transferrin receptors, and D. Ferritin.
Transferrin receptor.
Wrong.
Myoglobin.
Correct. That's the correct answer.
Thank you.
Histopathology. Histopathology.
Alright. The functional unit of the breast is called what?
It's cyanide.
No.
Lubule.
No. It's called the terminal stalk lobular unit.
Let's be quiet.
Hematology. Hematology.
Hematology.
Hematology. The most frequent crisis in sickle cell homozygous disease is what? A. Aplastic crisis, B. Vaso-occlusive crisis, C. Hemolytic crisis, D. Bone marrow failure crisis, and E. Visceral crisis.
Vaso-occlusive crisis.
Correct.
Next one.
Hematology. That's cool.
Vitamin B12 is found in the following food items: A. Fresh fruits, B. Fish, C. Lettuce, D. Carrots, E. Cereals.
Fresh fruits.
No.
Lettuce.
Wrong answer. Fish.
Thank you, supporters club. Thank you, thank you. Let's be quiet. Okay, we are doing fine.
Bone.
Okay,
Hematology.
hematology.
following are examples of granulocytes except A. Neutrophils, B. Monocytes, C. Polymorphs, D. Basophils.
Monocytes.
Correct.
Hematology.
All the following are false about infectious mononucleosis, except A. Caused by secondary infection with Epstein-Barr virus. B. It is associated with low titers of heterophil antibodies. C. Infection is often subclinical. D. It is characterized by lymphopenia.
Infections are often subclinical.
Correct.
Pharmacology.
Okay. Which of the following is a direct vasodilator? Amlodipine, terazosin, kilasapril, adralazine, acebutolol.
Hydralazine.
Correct. Next.
Hematology.
Possible drugs in AML, acute myeloid leukemia, include the following: A. Cytosine arabinocyte, B. Imatinib, C. Etoposide, D. Daunorubicin.
Daunorubicin.
Wrong.
Cytosine arabinocyte.
Wrong answer.
Yes, please.
Imatinib. Correct.
Except let's be quiet, please. That round is done. Hello? After we have finished this round, if you have any complaint, you express it. It is done.
Pharmacology.
Pharmacology. After this round, please, we will accept complaints. Let's finish, please.
Sorry.
Common side effects of tricyclic antidepressants, except hypertension, tachycardia, blood vision, postural hypotension, dry mouth.
Postural hypotension.
Wrong?
Blood vision.
Wrong. Now you can take your complaint.
Okay. part of the question. We have certain protocols we use in IFE, but we didn't yet accept. We are very familiar with the drugs in AML.
Wait. Before, wait.
The accept question of the question.
Are we ready to listen, please?
Yes, sir.
We will deliberate and decide what we do. Okay?
We are open to.
Okay. You take another question. Hematology. Please let's have some quiet.
This is the first and the last time we will do this. So don't try that next time.
The following drugs are associated with thrombocytopenia except A. Gold, B. Thiazide, C. Warfarin, D. Heparin, and E. Rifampicin. Wrong.
It was what
We have got an round for. This is the final round in this session. Okay? Sorry. Your options are only now limited to O&G, pediatrics, medicine, and surgery. For you that you are choosing medicine, then you have 3 other ones to choose from, isn't it? Yes. You have only chosen one from pathology. So you want to give, we will give you. But the others, please, you have pediatrics, O&G, medicine, and surgery.
Medicine.
In which group of diseases is the serum level of alpha-1 acid-glycoprotein increased? It is answer. It is just a simple answer. There are no options. In which group of diseases is the serum level of alpha-1 acid-glycoprotein increased?
Lysosomal storage diseases.
No. Inflammatory bowel disease.
O&G. True or false? Maternal umbilical artery-Doppler velocimetry is important in IUGR.
Sorry, repeat the question.
I said true or false. Maternal umbilical artery-Doppler velocimetry is important in IUGR.
False.
You are correct, my God. achieved. Sin 2, that is CIN2, can be managed with cryotherapy. True or false?
True.
Correct. ONG. Goserelin is a GnRH antagonist. It's false. False is correct.
Hello, Owen, you are making too much noise.
Microbiology. Sorry?
Microbiology.
Microbiology.
A 35-year-old man diagnosed with AIDS has progressive blurring of vision in his left eye. Fundoscopic examination reveals a small, white, opaque lesion on the retina of the left eye. What drug is most appropriate for treating this condition? A. Acyclovir. B. Valacyclovir. C. Nevirapine. D. Ganciclovir. And E. Amantadine.
Ganciclovir.
Correct.
Sorry. I will give you a question in urology. The following are associated with pheno-occlusive priapism, except A. Total parenteral nutrition, B. Sickle cell disease, C. penile trauma, D. Leukemia, E. Prostate cancer. Total parenteral nutrition. Wrong? Leukemia. Wrong. The answer is penile trauma. The penis cannot have injury and then we can't have ONG. Let's be quiet. In the photograph, action line is reached 4 hours before alert line. True or false? Please, let's be quiet. You are wrong. The answer is false. Please, let's be quiet.
Excuse me. We shall start to deduct marks from those who cry unnecessarily. Where you fans or colleagues,
And then Bowen.
please take note as Bowen.
ONG. Okay. Listen very well. True or false? Concerning uterine fibroids, hysterectomy is the definitive management. True. You are correct. Thank you. We'll give it to our recorder. What is the end of the first. Can we listen, please? Can we just listen, please? First round is over. Okay, at the end of the first round, the balance with 15 points. O is 20 points. Lasicon 20 points. Bowen 20 points. Lauten 20 points. Stanford is 15 points. OU is 10 points. University of Ilorin is 20 points. Thank you. We are moving to the next stage. I want us to listen very well. And please, let's not make noise. The instruction with this next stage is very simple. Answer as many questions as you are possibly able to under 2 minutes. I will not be calling out the options. I will just ask you the questions. If you don't know, say pass. The more options you give, and I say either it's true or false or whatever, is taken out of your time. You need to nominate one person to represent each school. Are we clear? After this round, your scores will be added to your previous score in round 1, and subsequently, it is only the top 4 schools that will be going to the quarterfinal. So, I will give you a few seconds to decide whom you want to represent your school. This series of questions can come from anywhere. What we want is that there is only one person speaking to us. If you, as a member of the team, want to assist the person that is representing you, you find a way of communicating to the person. Wait, but if we hear double results, 4, 2, 2, 4, I will just be quiet and be looking until I hear something from the spokesperson. Are we together? So, we will start from the first group, and we will crave the indulgence of the representatives to stand. Thank you very much. Your 2 minutes starts now. Mastana gravis is often associated with
Addison disease.
Wrong?
Pernicious anemia.
What is it?
Pernicious anemia.
No.
Pass. Pass.
The following skin lesions are associated with visceral malignancies. True or false? Impetigo-erythrasma.
False.
That's correct. Budd-Chiari syndrome is associated with the thrombosis of which vein?
Hepatic veins.
Correct. The most common presentation of acute cholecystitis is?
Right upper quadrant vein.
Correct. The most common colonic polyp is?
Pedunculated polyp.
No.
Sessile polyp.
No.
Pass.
Which of the following is least likely to be a risk factor for gastric cancer? Blood A group, Zollinger-Ellison syndrome. Which?
Zollinger-Ellison.
Correct. Individuals with blood group O are more prone to develop gastric cancer, duodenal ulcer, or chronic pancreatitis. Which?
Duodenal ulcer.
Correct. The most common site of primary gastrointestinal lymphoma is large bowel, small bowel, stomach. The following are associated with skin rash except rosacea, mycosis fungoides, eosinophilic granuloma.
Mycosis fungoides.
Wrong. Cesarean syndrome, pruritic erythematous lesions are associated with mycosis fungoides. True or false?
True.
Correct. The most common way by which people commit or attempt to commit suicide is by drowning or shooting, hanging, or self-poisoning. Which?
Drowning.
Your time is up, and that was wrong. The question about myself, it was thymoma. Yes, you keep talking. You have a choice to pass it. Okay, you have a choice to pass it. Okay. Which school am I in? O-U-T-H. Your time starts now. The least common type of bronchial carcinoma is?
Small cell carcinoma.
Wrong.
Pass.
Okay. Which of the following is the most likely to occur in atomic reactor workers? Bicyanosis, bagalosis, berylliosis.
Berylliosis.
Correct. Which of the following antibodies are found in the serum of 70% of patients with vaginal granulomatosis? Anti-smooth muscle or anti-neutrophil cytoplasmic?
Anti-neutrophil cytoplasmic.
Correct. The most useful investigation in pulmonary sarcoidosis is clave test. True or false?
True.
False. Neonatal diagnosis of cystic fibrosis is made by ill placement and to look for the level of trypsin. True or false?
True.
Correct. The most common complication of influenza is cardiomyopathy, renal failure, hepatic failure, or pneumonia. Which?
Pneumonia.
Correct. In a normal person, the ejection fraction usually equals to ejection fraction. 60%. The World Health Organization has used the definition of hypertension as blood pressure of 160 all over 95. True or false?
False.
That's true. That's wrong. Endocrine effects of pituitary adenoma include Cushing syndrome, acromegaly. True or false?
True.
Correct. Acoustic neuroma will not cause progressive unilateral deafness. True or false?
True.
False. Derealization is a feeling that the world is unreal. True or false?
True.
Correct. By the way, acoustic neuroma will cause progressive unilateral deafness. Okay, are we together? Next school, please.
Last school.
What's the name of your school? Last school, your time starts now. The most common cause of travelers diarrhea is a virus, a parasite, a protozoa. Which? The most common cause of travelers
Parasite.
Wrong.
Bacteria.
Wrong.
Pass.
Okay. The cause of bladder carcinoma includes all of the following except smoking, alcohol, naphthalene. 9 months, primitive reflexes and persist. Routine, grabs, or parachute.
Pass.
Okay. He said pass.
I said pass.
Get some pupils. I said parachute. Parachute, that is correct, sorry. Puberty in males starts with testicular growth, while in females it starts with what?
Breast. Growth, not growth first.
It starts with ovary growth.
I said,
wait. The question is, puberty in males starts with testicular growth, and in females it starts with what?
I said growth spurt.
And that is wrong. Okay? So I just wanted to clarify that. It starts with ovarian growth. Okay? That's ovarian growth. Hello? I think you got the parachute right and it has been marked for you. Okay, thank you. Which school is next? Owen. Please let's be quiet. Owen University, your time starts now. Which of the following is not a complication of multiple myeloma? Silicosis, amyloidosis, hypercalcemia.
Silicosis.
True. Immunoglobulin, most commonly associated in multiple myeloma, is IgG, IgA, IgM.
IgG.
Correct. In gynecologic malignancies, the percentage of endometrial CA is 60, 80, 40%.
40%.
Correct. Most common surgery performed on women is mastectomy, gastrectomy, splenectomy. Mastectomy. Which of the following is not a risk factor for uterine cancer? Herpes simplex, older than 35 years of age, eye parity.
Herpes simplex.
Wrong. Pass. Normal aging is associated with A. Systolic blood pressure increase, B. renal mass, C. bladder residual volume increase.
Systolic blood pressure increase.
Wrong.
Bladder residual volume.
Wrong. Pass. Pain in the right shoulder or right scapula is most likely associated with appendicitis, pancreatitis, perforated pelvic ulcer.
Pancreatitis.
Correct. Batten disease is a fatal inheritable disorder of nervous system and can manifest as such: seizures, behavioral changes, slow learning, or all of the above.
All of them.
Correct. The most common cause of congenital heart failure is chronic hypertension, coronary heart disease, dilated cardiomyopathy.
Coronary artery disease.
Correct. Regarding Campylobacter, which of the following is wrong? May cause Guillain-Barré syndrome. The illness is caused by a virus.
Which of the virus? Wrong.
Yes. Post-Jaga syndrome is inherited as
Autosomal
complaint. All Owen University students, please step out immediately, or we will deduct them marks.
Owen minus 5 marks, or you step out.
Are you ready for us? Louder. University. Your time starts now. The most common reason for splenectomy is
splenic rupture.
correct. The most common bile neoplasia is from adenocarcinoma or lymphoma, which
Adenocarcinoma.
correct. Gallstones are symptomatic in 30%, 80%, 50% of candidates.
In 30%.
Wrong.
80%.
Correct. Which of the following hepatic disorder is most likely to occur in women using OCT? Abscess, cyst, adenoma, or hepatoma?
cyst.
Wrong.
Adenoma.
Correct. Which of the following is a normal male karyotype?
46X1. 46X1.
Correct. Which of the following is defined as distorted perception of stimulus? Delirium, illusion, or delusion?
Delusion.
Wrong.
Illusion.
Correct. Opiate intoxication is characterized by miosis, hypotension, bradycardia, increased miosis. The hallmark of rabies is the presence of what in the brain?
The hallmark of
Rabies.
rabies.
Okay. Temporal arthritis most commonly occur in elderly men, young men, elderly
Male.
wrong.
Young male. Continue. Pass.
Okay, epigastric pain radiated to the back and improved by leaning forward
Acute pancreatitis.
is called what sign?
Bastard sign. Pass.
Okay, which of the following is most common in ulcerative colitis? Gallstones, erythema nodosum, actus ulcer, peripheral neuritis. No.
Pass.
B12 malabsorption is diagnosed by. Please, we should not interrupt. You are making your school lose mark.
It wasn't like I was interrupting, my brothers that were interrupting.
Wait, please.
I said shooting step for the last question. People were interrupting when I was asking questions.
Wait.
I was answering when you gave options. I was answering.
Wait. Are you ready to listen to me?
I am, sir. Thank you.
Your time was over before I started addressing the crowd.
Thank you, sir.
Okay? Please have your seat. Thank you. Please, we want people to enjoy this program. But when university coming again, but please, let's try to maintain the choreo. I do not know the reason why people were shouting.
Hello? Oh. Can you sit down, please? You make your complaint after, right? If your session is over.
Okay. Well, the recorders have pointed out something which we will clarify. Okay? I gave two options and you answered the first one and then you answered the second one. Are we listening? If you choose not to listen to me, I will disqualify you immediately. Okay? The disqualification will be immediate. If I have people shout at me again, okay? And it will not be revocable. For that, Lautech University, you lose 5 marks. Bowen University has already lost 5 marks, by the way. Okay? So, please, if you keep on doing it, you keep on minusing. Okay. Are we ready? If I give 3 options for speed, you may answer it, but the recorders will tell me when we are finished and they will minus as at when due. Okay? Observation?
Sir, there are some questions that you gave for options and it went up with third attempt. Like when you use for options.
Okay. As it were, now tech has been penalized, we move on. Okay? round, your observations will be attended to. Next one, please. Back up. Back up. Back up. Your time starts now. Severe disease is characterized by breathing enteropathy. Good. More.